I'm gonna, I'll meeting, bring it, need a motion on the agenda as presented.
I move to approve the motion as presented on our
Okay,
agenda.
need a second?
I guess,
Second, we got a second. All in favor, signify by aye.
Aye.
Opposed, same sign. Need a motion on the minutes from the previous meeting. So moved. Moved by Brad. Second,
Would it be somebody who was here?
I'm sorry.
Should it be somebody who was here at the last meeting?
I would move to accept the minutes as presented on from the agenda.
second.
All in favor?
Aye.
Opposed, same sign. We're gonna open it up for the election for officers to run this committee. Not to run it, but to organize it.
I nominate John Boniface for chairman.
Okay, John Bonaparte is nominated. Do you have any other nominations?
Nominate myself.
I'm sorry.
I'd like to nominate myself.
Okay, Fran Duncanson nominated herself. Any other nominations? Okay, we'll have to run a secret ballot.
Okay.
The ballots. One moment, please. Put a party on.
I thought you heard us.
I
I
think
thought
it's
you
worse.
to our rescue.
Yes.
Like two, they're small.
Right here. Sabrina.
Oh, hello. I've never even seen you before, I feel like.
Morning, boss lady.
Morning.
Waiting 1 minute here.
It's pretty close to 80 today, I think, huh?
I don't know. It's supposed to be.
Yeah. I have one.
Oh,
There it is.
It's right down to you. Oh.
Got my flowers done this weekend. Got my garden plants.
Okay.
Robin nesting in Rio Lake. Oh. My cats sit by the.
it is Fran as the chair with a vote of 5-4.
Okay. And with that, we need to elect a vice chairperson. I would like to open nominations for a vice chair. I'd like to nominate John Bonaparte for vice chairman.
I'll second it.
Any other nominations?
I'll move that the nominations be closed and we'll take a unanimous ballot to have John be the vice chair.
And I'll vote on a unanimous ballot for vice chair for John Bonaparte for vice chair. Signify by saying aye.
Aye.
Okay. And so we have a vice chair. At this point, agenda item number 5, public comment. Do we have anyone here today who would like to make public comment? No, it does not appear that way. So with that, I will close the public comment portion of the meeting. Do we have any supervisors here today that are not committee members who would like to make any other comments or have any information that they would like us to have?
Chair.
Chair?
Chair. Can we do an
Oh, sorry.
intro of all of the members?
Yep, I certainly can. Thank you.
Yes.
Thank you for pointing that out. So should we go around the room then and each one of us give a brief introduction of ourselves? Okay, let's start on,
At this end, oh, they're gonna start down there.
Sure, I'd love to. Kathy Jingers, I am the Business Services Director for Community Services Division. Helen Swanson, I'm the Public Health Director.
Diana Peterson, Economic Support Manager.
Morning, Lee Wallen, Department of Children and Families Director.
And Jay Luke, District 11, County Board.
Good morning, John Bonaparte, District 15, which is basically town of Farmington and county first vice chair.
Brad Olson, District 1, Polk County.
Pam Garvey, District 4, Polk County.
Fran Duncanson, District 12, County Supervisor.
Tony Johnson, District 10, Township of Osceola, County Supervisor.
Anya Eichel, the Community Services Director.
Sabrina Meadow, I'm a citizen member on the board and I'm a family nurse practitioner.
Rita McKee, citizen member on the board, nurse practitioner.
Me too. I'm Bill Oliva. I'm also a citizen member of the board, retired.
I'm Artie Elias. I'm a member of the citizen, member of the board.
Nicole Ewing Vitalis, Child Support Agency Manager.
Malia Malone, Corporation Counsel and Deputy County Administrator.
Laura Wagner, the ADRC Director.
Don, do you want to say who you are?
I'd be happy to. Don Wortham, General Government Director. I'll be inflicting some budget information on you later today. And my colleague,
Sherry Poyer, Finance Manager.
I'm Claire Johnson, Public Information Specialist here at Polk County.
Okay. So with that, let's pick up from where we were. If we have any other supervisors not seated as committee members who have anything for us today, it looks like Jay, that would be you. Do you have anything for the committee today?
No.
Okay.
He's also an ex officio member of all the committees, so.
Oh, okay.
he would technically be considered a member when he's here.
Okay, thank you. Yeah, thank you for pointing that out. Okay, then moving on, we have a veteran services presentation.
And Andy is not able to be here today, so if we could table that until the next meeting. He
Okay,
does have a presentation he wants to give. He just was not able to make it.
okay, so do we have a motion to table that to our next meeting?
So moved.
Second.
Any discussion? With that, we will vote on tabling to the next meeting, the veteran services presentation. All in favor signify by saying aye. Opposed, same sign.
Minutes should reflect that is postponed to a date certain rather than table. This table is just for laying something on the table.
Okay, so it's postponed till our next regular meeting, which would be coming up on June. I don't recall the exact date, but in June. Okay.
The 12th, maybe.
11th, it's on the bottom right here.
June 11th, my wedding anniversary. Okay. All right. And with that, no discussion. We had a vote. So moving on, there is an ADRC presentation. And who do we have today for that?
I'm here again, Laura Wagner from the ADRC, the director. And thank you. I'm very happy that I don't have to follow Andy because he had a beautiful PowerPoint presentation. I'm a little more old school. So you're getting handouts. Bear with me here. And I am not going to sit and read all this for you. But I'm just going to do a quick overview, and then that way you guys can, in your leisurely bathtub in the evening
With the candles.
with the candles, maybe a glass of wine, you can take a gander And if you come up with any questions, then I'm hoping you reach out and me and ask. Okay. All right, so a little bit of history is what we're gonna start with, because I understand the goal is just give a brief update on the ADRC, what we do, and just give a little bit of a background. So, state of Wisconsin back in the 1999, 2000, was looking at doing a redesign for the long-term support services. Previous to this redesign, everything was being done, taken care of within the county human services program or agency. And that included the waiver programs, which now is case management through interim and the long-term family care programs. There's also IRIS, which is a self-directed, some of you may have heard of, and APS, and then the eligibility into those programs. So that was split into 3 different areas. APS, Adult Protective Services, stayed with Human Services or Community Services. And then the ongoing case management went out to the managed care organizations, and the determination for eligibility stayed with or went to the Aging and Disability Resource Center, the ADRC. So the feeling at that point was that it can be very complicated when people are either aging themselves or taking care of family members that are aging, and they don't really know where to start. All they know is that they're in a very stressful situation. They hear there are programs and resources out there, but how do you know where to find them, get eligible for them? And so ADRCs are considered a one-stop shop for people to reach out if they have any questions regarding aging, disabilities, care, being a caregiver. So we do have resources for those different areas. So as far as looking at the history, I have for you a little write-up, because we opened our doors down in 2009. It's our 15-year anniversary. And we started very small. And what I put together here is a series of org charts as we grew throughout the years. So you'd see, if you flip over the first org chart, we started with 7.5 staff, with 5.5 being Polk. So when the ADRC opened their doors, it was, and it continues to be, an intergovernmental agreement between Polk, Burnett County, and the St. Croix Chippewa Indians. So we have offices here and in the Burnett County Government Center, with the same services being provided by both. And without there really being a county border. The finances are managed so that any program income that comes into each county saves the levy dollars for each county. So that is not combined, and that is something we are very mindful of. But so we started off with just the basic ADRC services, with it, which is information and assistance. So when people do call in with questions and needs for services, it's very individualized to what everyone's very specific situation is. And preferably it's done face-to-face, but we do it over the phone as well. People can come in, and we do go out to the home, which is not unusual based on the population that we serve. So we have the information assistance, which is a general catch-all. We also have benefit specialists, And there's two of them, a disability benefit specialist, which goes up to age 65. And then at 65, it's the elder benefit specialist. And they're both specialized in, for the younger ones, the disabled kids that are transitioning out of high school, working with those. And then, of course, the elderly gets into the Medicare and different benefits that each one may be eligible for. So that's kind of where we started. And then back in 2012, the aging director here in Polk County moved on to a different position. And here the aging programs had a completely independent office from other agencies within the county. And that came under the umbrella of the ADRC. And that you see at the next org chart where it jumps up then to 24.5 positions, with 22 being in Polk. A lot of those being the site staff. Then following suit, Burnett County's aging director retired. And so we ended up taking on those programs as well. So how we are running it now is we have one supervisor that is overseeing the nutrition programs for both counties. Those programs are the ones that tap into levy dollars. There are actually no levy dollars that go into the ADRC programs, the original programs, but it's the aging programs that the levy dollars support. And that is primarily the nutrition programs. Also, along with the nutrition program came the transportation programs, and then some caregiver support programs as well. So those are being managed by the same supervisor covering both counties, and managing the nutrition ones are managed separate because, again, those are really reliant on the levy dollars. And when we took over the programs, the nutrition programs, the delivery systems themselves were run differently. As you will see when you dig through it, and I'm not going to do a real slow overview, but we did work over the years to get more efficient with these programs. And we have lessened the number of meal sites, which saves on the staff time and the overhead for maintaining the rent and utilities. So we are down now from, we had 5 sites in Polk and we're down to 2 now. And in Burnett County, actually, last year, we became a central kitchen that served the county as a whole to have the home delivered meals go out. And on their end, and I know this so well because we're still in the middle of making changes there, we are saving about $66,000 a year by doing a central kitchen. So when we're done with that, we're trying to build a whole site there. When we're done with that process, we'll do an evaluation in Polk to see what kind of savings we can do here as well. However, we've already gone down to 2, and I don't know that the savings will be quite as significant to make it worth what we're going through right now there. But that evaluation will be done to see if we can do some more savings here as well. All right, so then I won't go through all of this, but basically we just continue to grow. And as of March of this year, we have opened a transportation office. We are expanding out of our populations that we are to serve with the plan of the transportation office, which is actually located right on the other side of this wall next to Andy and the SO there. And with the hopes that that will be an independent office. The finances will probably continue to flow through the ADRC, but we are serving low income and mental health services, mental health clientele there as well, which is not in our population. So we need to be a little more mindful of the financial handling with that, but that's something you should all be aware of. So I did put in your packet a flyer for the mobility manager. And that kind of summarizes the growing transportation services. We are also adding or have added this year some voucher programs or voucher money to help support individuals who have people who could drive for them, because we are struggling getting volunteers. We rely on volunteers for a lot of the driving. And if we cannot get the volunteers, we need to try to help support individuals to get to their health needs being met and their essentials. So we have vouchers which would be given out once a month to allow for some support to go towards neighbors or someone that would be willing to drive for them. So there's information on that in here. And then I also have a copy of a PowerPoint that we do actually for community services for their new staff, which is wonderful. I'm glad we're invited to do that. So that gives them a understanding of what services we do provide. And I just have that here for you. If you get thinking about any questions, you may find it in there. Oh, yes, one newer program that I forgot to mention is the dementia care specialist. That is, of course, a growing topic in the States, and we do have a very active dementia care specialist, and she runs a coalition that is an active group as well with people out in the community to help support that and get information out there. We do a lot of community education events, some health programming, preventative health. We work with Helen quite a bit as well. So we are enjoying partnering with our community services here. And that is a very quick overview of a lot of what we do. So if you have questions right now, feel free to throw them at me. Otherwise, you know, if you would let it absorb, you can certainly reach out. Yeah.
You mentioned that number of mail sites has gotten down to 2 or 3. Has your number of people that you serve also went down? I used to be a volunteer for meals for homebound. And your heart really goes out to the people that can't get to the meal sites that are homebound and are in dire need of nutrition.
It has not gone down. Actually, it has boomed. What happened is, and I hate to blame everything on COVID, but this truly is connected, is that the state had relaxed the eligibility requirements for home delivered meals over COVID. And so everyone was pretty much considered homebound at that point. So a lot of people became aware of the program and saw the benefits of it. And once that program, the eligibility got restricted back to homebound, there's still so many of them were truly homebound, and we cannot keep up with that. We actually have now started waiting lists, and actually there has been a waiting list for almost 2 years now. And that is why we are looking at centralizing to save the money on the overhead and staff costs so that we can get more home delivered meals out there.
We have enough drivers.
Not always. That fluctuates as too. We need drivers. I'd say down in the Clayton Clear Lake area is an area that we have a hard time filling there.
Where's our 2 central places? Dresser and Amory?
Amory and Milltown. So we go out from there So they cook on site, so it's scratched cooking on site. And then we have volunteers that come in and some staff come in, they package them up individually and separate them into different routes that take them out into the communities. Yes.
Couple of questions. One, based on that, when you needed to combine the kitchens, how did that affect like food quality and distribution? I mean, was there any kind of increased cost as far as making sure the hot meals stayed hot with I'm assuming it's increased distance. So I'm just curious how all that kind of fell together. So that's my first question.
Yeah. So you're absolutely right. Up front, there was additional costs in supplies and equipment because we had to upgrade the delivery, the boxes and that to get them, we couldn't just rely on the heat pads. They had to be plugged in. So we had to put out more up front to get the equipment to keep that heat through the whole trip.
Yep.
Because some of the routes can get up to an hour and a half.
Sure.
So that's why we would love to get more volunteers so we can shorten those routes as well. But the savings overall with the staff and that overhead ongoing really makes up for that hit up front with the equipment cost.
Thank you. So second question is more about the transportation office. How, and forgive me if I should know this, but I don't. As far as how much do you interact with private or community other resources for like transportation? Like, I mean, when I hear that, I instantly think of interfaith caregivers. So how much do you coordinate with them, or how does that, or doesn't that happen?
It does happen, absolutely. And part of developing the transportation office pulls in that mobility manager. And she just started in March, so we haven't quite gotten there yet. But part of that is reaching out to all of the individual transportation providers out there and coordinating efforts. Now, Interfaith, we have worked with for years, from when we opened our doors.
Sure.
So there, it always has been an ongoing working relationship. But there are individual private providers out there, and our goal is not to replace them at all, is to supplement what is happening out there.
Sure.
Plus, we are limited in our resources with volunteers and money. So the goal of that mobility manager is to understand what the limitations are of the other resources out there. So when people call or walk in, that mobility manager works with them as far as what their needs are, what they're trying to do, where are they going? Can we tap into some of those private resources out there, utilize them? And if not, then are they in a wheelchair? Do we need to use one of our lift vehicles? Can we use a volunteer driver? So that's kind of the detail that position will be working with.
And I know there's restrictions as far as HIPAA and things like that, but I know a lot of hospitals also have care coordinators. Is that another resource that you guys kind of take back and forth at different times when trying to fill some of those needs?
Yes, that is a harder one because those are so last minute, the discharges. So we have, that's in discussion right now of how we can go about supporting them, because it is hard without having paid drivers on the ready. It's hard to be able to just jump in and do a discharge.
Sure.
Because once people are allowed to leave, they want to get out of there. So they don't really want to wait a day or so for us to be able to find someone to do it. So that we're aware of that, but we don't have the answer yet on it. So that's something we're working on and trying to figure out.
Sure. Thank you.
I have a quick question also on the transportation mobility issues as well. You mentioned that you rely a lot on volunteers for that. Is there any special training or licensing that's needed by the volunteers to be able to, say, drive the lift van or do those things?
Yeah, so we have two different programs. One is the volunteer driver, and then the other is the lift vehicles. And there we actually contract the drivers out from a home care agency. So they're actually, for the lift drivers themselves, they are employed through a different agency. So the training, they do go through some significant training as far as tie downs and safety. The buses that we get are intentionally small enough that they do not need the CDL license. So the one we have out here is the largest we can go without needing the CDL. So, and that holds 2 wheelchairs, has some jump seats, flip seats, so we can expand it to all
Unknown caller.
mobile able individuals up to 13, or I think it's 10 with 2 wheelchairs, something like that. So, but those do need to have a little extra training. They don't need it coming in, that can get provided. But they are actually paid though. But the volunteers, no, they don't.
Thank you.
Anything else?
Laura, this committee had looked at, for 2 years, we've been looking at public transportation, and I think that has been turned over to your office.
Yes, so I was here when this all started.
Yes, you
and
were.
came here. And so Tanya and I took the lead on that, and we worked with the Regional Planning Commission. They did the feasibility study for public transportation, which ended last year, or
Early last year.
early last year. And that's kind of what pushed us into getting the mobility manager.
Okay.
Because we were looking at the different potential public transportation as far as fixed routes or door to door. And at this point, it was determined that it would be better to get someone in a lead role, because truly that transportation program, which is greatly needed here, didn't have someone who could focus just on that. So we decided to go with the mobility manager, get this office set up, utilizing the services we already have, adding in the mobility manager and the voucher programs. And then once this gets established, that mobility manager is going to be starting to look at other grants that are out there to see what else we can do to expand the services here. But this is a starting point for the office, hopefully to get a little more. So, yeah.
Thank you.
Yeah, you bet. Anything more? These guys know everything anyway. All right, well, thank you. And you have my card. If you think of anything else, just hunt me down.
Thank you, Laura,
Yeah,
very
you betcha.
much for that presentation. Okay, looks like up next, we have an update regarding child support. Malia?
So before I give the update, which is super exciting, and I'm not kidding, it really is, I'll just give a brief overview of child support for the new members. So child support program in Wisconsin is a state program that is funded by the federal government, but the counties operate the program. So each county and certain tribes have their own child support agency. And we primarily do 3 things. We establish paternity. In other words, get fathers' names on birth certificates when children are born out of wedlock. If parents are married, both parents that are married end up on the birth certificate. That is even true if they're not the actual biological parents. But if you're unmarried, then only the mother's name goes on the birth certificate unless they sign a voluntary paternity acknowledgement or come visit our office and get tested and go to court, and then we'll get the father's name on the birth certificate. The second thing we primarily do is establish child support orders. We get referrals from economic support when folks go on public assistance. And that kicks us into gear to getting child support orders for a parent who is not in the home of the child, or maybe who has the child less, to pay the other parent. The idea, of course, is to have both parents supporting a child. We also get referrals over from child welfare when children are placed out of home, and juvenile justice when kiddos are placed in certain types of detention centers. Again, the goal is to have parents pay for the support of their children rather than taxpayers. We get reimbursed 66% on the dollar, or 66 cents on the dollar, which is also 66% anyway. Never trust a lawyer's math. And So there is often times where we are giving levy money back to the county from our budget, because in addition to that recoupment for every dollar we spend, we also get paid on performance. So when we do well, when we are getting fathers' names on birth certificates, when we are establishing child support orders. Oh, I forgot to say, the third thing we do is enforce those orders. We will take away a driver's license if you're not paying. We'll take away your professional license. So if you're a lawyer, a doctor, a nurse, we're going to take those licenses if you're not paying your child support. We're going to put liens on your cars, liens on your property. We're going to seize bank accounts. We've started to do a lot of that more recently, and we're having success. We also lower child support amount payments when, or court orders, when a parent has some type of issue and they're unable to pay. So we can be the kinder, gentler, but generally, we're more of the enforcer. Now, Nikki Ewing Vitalis became our child support director a few years ago, and she has increased our performance incredibly. We, for years, were doing okay. And when she became the director, all of a sudden, our performance numbers just increased. And it's because she was one of the best child support specialists. And when she was promoted, she started teaching all the new folks that were coming in to do the work the way she would do it. So I'm incredibly proud of her. And so is the state. And I don't know if you want to come up here, and I know I'm sitting here. We received this year for 2023 an Outstanding Achievement Award. We are one of only 9 counties in the entire state to receive this award. This means we established paternity at above 90% rate. It means we established our court order, new court orders at least 80% and have increased at least 1.5% from the previous year. And the collection rate of our current support increased from last year. Again, one of only 9. And so I'm incredibly proud of Nikki and the entire staff. I certainly can't take any of the credit because I don't do the child support court work. The other attorney in my office does. So all I can do is stand up here and say, I really pick good people. That's the child support update. Any questions?
Any questions from anyone for Malia? Nope, doesn't look like it. Thank you, Malia. And thank you for all of the work your department does, and kudos for the great job on that. Let's see, moving on, we're going to talk about the 2025 budget presentation and discussion of committee budget priorities. I can just
Let me get some paper organized for you all. Claire, if you look like you're all ready. This is such a large committee and I'm a budget guy, so I never print quite enough, but Bill, I know you and the doctor can share. I think all the supervisors get their own too. Let's see. Okay. So, budget season is upon us. My favorite time of the year. Try to make it a little longer every year. No, we're getting a little bit of an early start. And what I want to do today is get up to the 30,000, 35,000, 40,000 foot view and show you what we're seeing in terms of big picture for the 2025 budget. So our goal is to have a budget passed in November. It's not only our goal, it's state, this Corporation Council will remind us. And now's a great time as a committee to be thinking about your budget priorities. The next agenda item will get to how things look so far for last year. So we'll have a little bit of information of what we're seeing in the future, of a little bit of information about what we think happened last year unaudited. And it'll be for you to think about what's going on in 2024 right now and how you might want to apply that to 2025. So a lot to keep in mind. My office is just one floor up if you ever need to talk with me. Let's get going. Early view. So here we are just 5 months into the 4.5 months into the new year. Everything that I'm discussing is subject to change, which means any of the implications you might draw are subject to change, or I might draw. Let's talk first about the situation that we're seeing in the state and across the country. Right now, or at least in March, the most recent information, inflation was at about a 3.5% clip. So that's down year over year, but up just a little bit from the previous month. Most recently, the Fed kept borrowing rates steady, about 5.3%. That's great for us in one way. And eventually we'll talk about how it could actually be great for us in two ways. We manage about $31 million in investment money. And so right now we're getting pretty reasonable returns on those dollars. So that's great. In terms of our workforce, unemployment's up just a little bit. We think that the labor economy is softening somewhat. Right now, we're real close to full in terms of our department's staffing levels, which means we're spending more budget dollars, but it means we're also able to get things done, right? In some of our previous years, we haven't been fully staffed. Consensus is labor market's cooling. It's a little easier to hire, which is a bit of a change from previous years. Last year, we talked about some instability in the broader economy. We had some bank failures. Right now, the Fed seems to be mostly concerned about commercial real estate, softening in urban markets of office buildings in particular. Whether that has any impact on us, we're not really sure, but that's sort of the Fed's view. Any questions about this? I think this just thumbs up what I mentioned. I will say that with an inflationary economy, our dollars buy less. Second, we'll talk about what we're going to do with expenses on the budget side. When we can buy less, that means a zero budget increase means you can actually do less. Let's keep that in mind. I'm not great at reading the crystal ball. Last year, there was discussions about recession. We still have some of those discussions going on. It seems to me that there's a mixed perspective on it. Let's go to the next slide and talk about revenue. Each month at General Government Committee, Mo provides information that we get from our financial consultants on sales tax revenues. They're roughly mirroring inflation. So we've been, if you look at the last 4 months, we've been right at 3%. We've had higher increases on a percentage basis the last few years. Last year, we budgeted, or for this year, we budgeted 4.8 million. We're guessing we're going to end up at about 5. What we often do is use last year's results and model those for the next budget year, and we're likely to do that for this year. So take the 23 results and or what we expect for 24 and model that for 25. So we're thinking about 3% or roughly there on sales tax. Levy's a different story. Levy doesn't increase with inflation. Levy increases for the most part due to net new construction. So when we build new stuff, we have to service that. So the state allows us to capture some additional revenue dollars. But that's roughly 1%. So we can't fund our operational costs if they were to increase at the rate of inflation with levy. It's just not possible. For 2025, we're modeling $0 being transferred from the general fund to support operations. We like to leave our savings account for capital. So that's the plan for 2025. We do have some information from our consulting group, PMA, about our debt capacity. So we have roughly $2 million in debt capacity to stay within the previous board's guidelines in terms of debt service, which is about $2.45 million per year. So we can afford to borrow about $1.92 million at current rates. And if we were to do so, that would be a board decision, but we would do that to support infrastructure improvements deferred maintenance capital projects. Any questions about revenue side? Sum up slide here. I think I covered all of this. Yes. Let's talk about expense. So right now, I said I don't have a crystal ball, but others do. And right now, the consensus is that the Social Security Administration will set COLA for Social Security about 2.6. So that'd be down from the current year. So we often look at that number and think about what are we going to do at the county for our own wage increases for cost of living. So we're currently thinking about something in that 2.5 to 2.75 range. One thing we know for sure is our benefits, particularly our healthcare, will be more expensive in 2025. It was more expensive in 23 than in 22, more expensive in 24 than in 23, and it is so far, and we're expecting 25 to be even more expensive. Nationwide, healthcare expense is forecast to go up 7 to 10% for everybody. Our consultants are, because we have some very expensive cases, we're self-funded. They believe that our healthcare costs will increase substantially more than the national average, as has happened each of the last 3 years. So we know that the cost of paying for our employee base is going to be more expensive next year. In terms of non-employee related operations, we always, at least since I've been general government director, we go in modeling a 0% increase for departments. As I mentioned a few minutes ago, inflationary economy, that means there's less money to do things really in real dollars. Important point that I know Mo likes to stress, as we go into budget season, he asks that departments look at what they can easily manage and what is tough to manage. All expenses are manageable at some level, but I made a joke about printing off documents for you. You know, when paper prices go up, we can print on both sides. We can not print in color. I can put 4 pages on 1 page. There's all sorts of things I can do to push down my paper expense or what I spend on paper. And this is important. You know, in this committee, we've got, you know, a division that is told they have to do certain things when there's a child placement. There may be low flexibility for some departments. And so the county administrator is very keen on asking departments to think about what's easy to control and what's not so easy to control. And at some point, you know, folks that are more closely associated with the actual work of child placements might want to address that with you in terms of thinking about what's going on in 2024 and projecting it into 2025. So top part of the slide is about operations. There's not much at this point to say about capital expense or expenditures, although I mentioned a moment ago that we're going to look at bonding as an instrument to accomplish some infrastructure and deferred maintenance projects. Right now, I've got a roster of at least $1.5 million of projects. So in just a moment on the next agenda item, we'll look at some sort of high-level financial statements or financial information for each of the departments that this committee has oversight for. And you'll see that most of the organizations or all of them are low, not capital intensive. The operations that are managed by the folks in this room and that you oversee are operationally intensive rather than capital intensive. Important to keep in mind. Any questions about what we're seeing as we go into 2025 budget cycle?
What is our total bond obligation, and is our rating number 1?
Well, we don't have a rating at the moment, sir, because we haven't
Really?
borrowed. Well, we've had private placements for the last few projects, so we haven't had to have a bond rating. Now we are in discussion about whether it would be appropriate to choose the markets rather than a private placement if we were to do bonding or borrowing. So then we would have to work and get that. all the information that the agencies want to see to give us a rating. But we don't have, we're unrated at this point. We have every reason to believe we would be highly rated, but because we haven't had to borrow through the capital markets, we haven't had to do that.
We do have bond obligation now.
We have obligations, yes.
Thank you.
And we try to keep those, the board has set sort of a maximum amount of debt service at 2.452. Now that could be changed by the board at any time, it's your prerogative. But that's something that we operate under as a stipulation that we want to keep our payments below that number. Any other questions? Should I just stand up here? Should I go sit down and come back?
Keep going.
Okay. So we've been doing this for a couple of years now.
Yep.
And what I'm passing out are unaudited, high-level statements of the performance of the departments that you have oversight for. And I'm going to walk you through a few things, high level. I'm going to get it.
Sure.
Okay, so those are, these are, I've got two little, that's a packet and this is a singleton. The singleton is for GAM, it's an enterprise. So they're quasi-independent. Must have the driest fingers around. What are those little rubber things you put on your fingers? You need that, you need the green eye shade. Oh, there we go. I'm gonna steal one from someone. I gave them all out.
There's an extra one, Don. You want the sink?
Yeah, perfect.
That's.
Yeah, maybe I'll just stand by you.
Okay. Yeah, we can
Okay.
help you.
All right, so I'm gonna grab the package
Sure.
first, the one with the staple in the weird place. So the top sheet is for human services. So basically CSD, the Community Services Division, is split into two groups. Human services, and on the next page, we have public health. And see that I felt rich. These each got their own sheet. If you look at the dot, it's about 2/3 of the way down. You'll see that there's a number 877,347. This is amount that was reallocated to the general fund from the operations of human services. So this is unaudited. And we can't call it a profit because we're not a for-profit organization, but we call it a surplus. Now it's non-audited, so we don't know if it'll hold up. But there was a surplus or an excess in operations of about that amount for human services. If you flip to public health, you'll see that it also had a surplus. As did veterans and ADRC. And on the enterprise sheet that I handed out, so did GAM. So if this were a for-profit organization and the audited numbers held up, the departments and GAM that you all have oversight over returned a surplus to the county. Now, there's lots of reasons why that could happen. And without getting into details, which we can't right now, it's impossible to say. Sometimes organizations run surpluses because they don't have enough people. They can't get their work done. And they have lower payrolls than you would expect, particularly in organizations that aren't capital intensive. So I would leave it to departments within the room here to talk about whether that is a possibility for running a surplus. You can also have excellent operations that would result in a surplus, or you could have a combination of those things. You could have lower expenses than you projected, that would contribute to a surplus. But what we're not seeing is a deficit situation for any of the organizations that report up to this committee. Now, that is unaudited 2023. Yes.
Sorry. I can interject, I just have a quick question. When do you expect to have audited figures available?
I'm looking at my colleague. We've just had the auditors last week. I think they believe they're running a little faster than they have in previous years, but you may know more about it than I do.
Guess to be able to present it to the committees, it would be your July meeting, would be our earliest. They just left on site, so they aren't gonna have it for the June meeting.
And who are the current auditors?
CLA.
Right, Carson,
Okay, yeah, they were here when I was here before.
Who's our audit firm?
yes, CLA, Clifton Larson.
Thank you.
And they're excellent. They've been with us for a long, long time.
They have.
What I can say, and the county administrators mentioned this before, in committee meetings and at the board, is that child placement costs are accelerated for 2024 beyond what was expected. When I was giving my presentation on the budget, I made the little joke about paper and how there's ways to control expense more, fairly easily if we have increased paper costs. These folks have to, they're told what to do with children that are in placement. They have to serve. So it's not a discretionary expense. And so we have some departments that have non-discretionary expenses placed on them. And departments that you have reporting up to you are in that situation.
That out-of-county child placement is the biggest expense in that department, isn't it?
It's a
That we
challenging
can't manage.
variable expense. Personnel costs are the biggest expense in
Yeah.
the department or in the division. But some of those personnel costs are related to taking care of children. But you'll notice that there's lines for contractual services. Those are where those would, the child placement, some of the child placement or the
Yeah.
majority would hit that. So over the next few months, as a committee, you'll have an opportunity to discuss the budget for departments that report, organizations to report up to you, and establish some priorities. And the earlier we hear about your priorities, the more flexibility we have in terms of, trying to figure out how to get things done. Every standing committee will have priorities, and it's up to you all as a board to make decisions about where at the highest level allocations get made. But it's time to start thinking about those sorts of things.
Thank you, Don. Anybody have any questions for Don before he sits down? Nope. Okay.
Again.
Yeah, thanks, Don. Okay, our next agenda item is for discussion and possible action regarding resolution 2424, a resolution proclaiming May as Mental Health Awareness Month. Tanya, would you like to speak on that?
Yeah, I can. So I think Lisa brought this forward to the county administrator for consideration. Just as a proclamation, I think that we are recognizing May as Mental Health Awareness Month. And it looks like, yeah, it's in your packet. So I don't know if you want me to read it. There's great statistics in here. And I think part of the role of the whole entire community service division is to, meet the county board's objective for substance use and mental health. This is one of the ways that we would do that. We've got lots of activities planned for this month for the awareness campaign. And just, I think, one of the main goals is reducing stigma, acknowledging it, getting people treatment, and the help that they need, and what the roles that all of our departments and the partners in the community are doing currently. So I think you can look at our website and there are the activities listed. Lisa Lavasser, the behavioral health director, has put in a lot of effort into coordinating these events, these awareness events. So we would just ask that this committee support this resolution, this proclamation for the awareness of Mental Health Awareness Month.
Anybody have any questions for Tanya about the resolution?
Oh, I have a question, pardon me.
Yes.
You said the activities that are happening for it are in your website?
Yes, there's some awareness
It's on the
activities.
SharePoint for staff.
Okay, we can send that out to you. Lisa, do you?
And I think Danny's been putting it on our Facebook page as well.
Yes, follow us on Facebook,
Facebook page for the county.
but we can,
For
I'll send-
CSD.
yeah, I'll send it out to you guys after.
Yeah, it'd be interesting to see that.
Yeah, and I can cover a few things that we're doing. So we kicked off on the 1st of May with just an email out to the entire county wide. And then last week we had Be Seen in Green on May 8th, which is Be Seen in Green. This is green is the color for mental health awareness. Tomorrow we'll be having a internal green bake sale. So basically behavioral health staff are baking and we'll have those things available for staff to buy. And any monies that we collect for that will go to the Mental Health Task Force of Polk County. And then next week, we also have a Be Seen in Green on Wednesday, the 22nd. We will have a walk around the building inside if it's raining at 10 and 2. And then at 2 o'clock, the behavioral health team is having a small ice cream social for internal folks serving mint chocolate chip ice cream. So anyway, that's really kind of it in a nutshell. Just some small things to recognize. We do have a display out in the lobby area that talks about mental health, the kind of services that are available, 988. We're kind of just switching it up each week with some different information for folks to pick up. Well, thank you. Yeah, thank you for all your efforts for that, and I'm sure the staff appreciates it as well. Thank you.
Know if Don has an update for the housing, those applications?
I could give a brief update. Normally Mo would do this, but we have one application in from a municipality for the Housing Partnership Loan Program. It's a total amount of funding of $200,000, and the municipality has requested $70,000, which is the max. So it's $10,000 per living unit. So 7 living units at $10,000 each. There's still sort of wrangling materials for us so we can review the application. And I know Mo's been in conversation with the folks there. Just don't know how much we've gotten in yet. But we do have an active application for that project.
Thank you, Don.
Madam Chair, I think Supervisor Olson had a question or comment, but I don't know if it related to this.
Just, are we moving resolution 2024 to the board or not?
That was my question too.
Yes, we kind of jumped ahead of ourselves a little bit there. So, yes, so at this point, I will entertain a motion to move ahead to the county board, resolution 2424 proclaiming May as Mental Health Awareness Month.
Motion to do that.
Okay, and is there a second?
I'll second.
Second by Velagas. Any discussion? And we will take a vote. All in favor, say aye. Opposed, same sign.
Well, you have to do one at a time. All in favor, say aye.
Aye.
Okay. All in favor, say aye.
Aye.
And anyone opposed? Okay, Malia for the, thank you.
No problem.
Okay, and we just had the update on the housing. Okay.
Brad's got a
Oh,
question.
Brad, I'm sorry. Go ahead.
As long as we're on mental health month. So Tanya, question maybe, because I'm new, so maybe I'm out of bounds here, but is there any, how close is the closest mental health facility? So like if, let's say the sheriff's department has to transfer somebody somewhere. Are we still looking at going all the way across the state with a number of those, or what's that situation like now?
Winnebago.
We have Amory Behavioral Health locally that has an inpatient unit, and
I could speak to that a little bit more. Yeah.
we hope.
Amory Regional Behavioral Health has an inpatient behavioral health unit. What we run into on occasion is, the consumer they're inadequate for their milieu, so we'll need to transfer to a different organization that can take that consumer based on their diagnosis, their behaviors, things
that. We did have an increase of admissions to Winnebago last year. And we'll see that in the 2023 annual report. With Purveya closing down in Sacred Heart, that took away a child adolescent unit as well as an adult unit. And then of course our detox and substance use financial services. So we have actively been pursuing contracts with other organizations across the state. North Central Health out of the Wausau area, Stevens Point, we've been working with them. We have a couple that are down in the Dane County area. Also Green Bay that we work with. So it's hard for those folks who are chaptered on an emergency detention, going across state lines gets a little sticky, I understand.
It's impossible.
Yeah. So we really, for those folks, we need to stay within the county, and those would be the folks that would be transported by law enforcement. Yes.
So
Supervisor Olson.
I'm assuming counties around us have the same problem.
They do.
Madam Chair, if I could make a comment on that, it's hard for any of us to really believe the cost that it takes drain on the sheriff's department. I was at a inter-county meeting, and Sheriff Scott Knudsen from St. Croix County, he just literally broke down and cried at the meeting. He said, I can't get enough sheriff help to take people to Winnebago and those facilities and run my department. And at one point here, a couple legislatures ago, they did appropriate enough money to build a facility, but the legislature did not appropriate the money to run the facility. And it's went by the wayside. And I was to 11 County district meeting in Hayward last Friday. And that was, it's been the number one topic for years. What can we do about a mental health facility that can be economical for transportation and facilitates needs that the counties have? It's really our number one drain. Sheriff Department and the committees. If you ever talk to any legislators, just remind them this dire need.
Supervisor Olson.
So we'll stay here. So having been here 8 years on the county board here, it's no secret to Malia, I'm a resolution writer. So that's where I'm headed with this. I see no reason that we can't work with neighboring counties, come up with a resolution that works for all of us to take to the governor, take to our legislators, to just to get something in, I'll just say, a closer facility to all of us in this portion of the state. I believe that's simply working with legislators. John is right, having a relationship with our legislators and getting that done. So I guess I would like to see that go in the work plan of working with other counties to get a resolution that can be agreed upon by all counties to pass the same resolution to push forward to our legislators, the ones that are here today, as well as the newly elected ones coming in November, to get a facility in our part of the state that's closer than Winnebago or Dane County or trust me, I know Dane County is exactly 4 hours from here.
Or more.
No, you can do it in 4, trust me. And so I think it's something that has been needed for a long time. And if you don't ask, you don't get. So.
Thank you for that, Malia. Oh, I'm sorry, Dr. Lagus.
Oh, I had heard that Ellie Phillips and also alcohol treatment center.
Chippewa.
Is that true?
Yep, they were a part of the.
Did they really?
Yep, Sacred Heart Hospital.
Right.
Yeah.
Wow.
So, Malia, what is the correct procedural approach to accomplish this? It wasn't exactly on the agenda that we were going to do a resolution. Is that something for a subject matter for our next meeting?
Certainly, and if
Yep.
the chair of the board or the administrator supports this resolution, I can start drafting before the next meeting to have it there. Or just maybe even just a rough draft, and certainly reach out to my counterparts in our neighboring counties and ask them for their support.
Sound like a good plan to
Yep.
everybody here? Thank you, Brad, for bringing that forth.
I just have, yeah, I just have a question. Again, you had mentioned going across the state lines is ridiculous or impossible. Say that.
Can't,
Okay, and that is,
because
We've
of,
got the interstate compact on the treatment of mental health. And so we can't go across state lines because it's considered dumping. And they can't come here unless we have a statewide contract with, obviously here it would be Minnesota. But the same is true in the southern part of the state with Illinois and
sure.
on the border of Michigan. Having said that, there are a lot of, because we've got some hospitals, you know, Osceola and St. Croix Falls, there's a lot of folks that naturally doctor at those facilities that are from Minnesota. So they'll come to our emergency rooms voluntarily, or family member brings them. They're in mental health crisis. And now our sheriff's department is driving them to Winnebago. So it is, it's, we're kicked in the teeth both ways when it comes to that. Because one, present here voluntarily, we have to treat them like, and that makes sense, of course.
Sure.
But what we can't do
Is take-
is say our law enforcement officer is going to detain this person in mental health crisis and drive them over there, because Minnesota law enforcement can't do that to drive them over here. So that's where we are. We are a border county and we know there's resources over there, but the laws are completely different as it relates to emergency detentions and involuntary commitments. One thing that has come out of COVID that's been positive is now our judges are routinely doing Zoom hearings. So at least our sheriff's department isn't driving to Winnebago to bring them back for their probable cause hearing. And then once we are finished, then turning around, driving back to Winnebago, at least that part has ceased. And we're doing those hearings by Zoom. But that doesn't fix the problem. It doesn't fix the problem when somebody is in Amory Emergency Department and Amory Behavioral Health is full. And so an Amory officer is having to drive to Winnebago.
Right.
You know, and they're more, it's just, it's not a good place. It's really about funding and deregulating a bit.
Well, right. Is there any sense in, as working on this resolution, that would be, I mean, or is that absolutely crazy to say, hey, if we're going to start pushing our state legislatures, are we also going to push for a compact for these counties with Wisconsin and these counties in Minnesota? The fact, I mean, we've got, I mean, I don't know, I know Hazelton, Betty Ford is a private, but I mean, it's an incredible facility. You know, is there a way to add that to the resolution, or is that just crazy?
Separate.
Or is that a separate resolution? I don't know. I'm just thinking of, the crisis is real. And I totally agree with the fact of you're not going to do, you don't get if you don't ask, but can we also tie that in because of the resources we have across the river and that problem? Like I said, it's just ludicrous to think that we have somebody that could potentially live in Taylor's Falls and we're going to drive them to Winnebago. That's just ludicrous. And it doesn't help people, you know. I'm just saying if they came over from Taylor's Falls to St. Croix Hospital and now they're here, now we're
Right.
shipping them. I mean, it's ludicrous and it doesn't help people.
I completely agree. But
Is there a way we can add that to the resolution, or does that, I mean, is that just
could
shoot
we
at the dark?
propose putting this on the agenda for next month with
So,
a
yeah,
draft resolution along with maybe a presentation on
Yeah.
what the facts are of our emergency detentions?
Sure. And
Just to give you guys some data and
right,
some
and I know
education on.
some of that stuff. I mean, I have a son-in-law that's a police officer, so he's had his multiple trips to Winnebago in his tenure, so.
So we'll present some facts on what
and maybe some history.
voluntary, involuntary history
Yeah.
as we are preparing, because there are grants out there too that the state is proposing for some private organizations. It's just not rolling down to the county. So we'll give you all of that information so you can move forward with the resolution. That makes sense.
Yeah, I like that.
Sounds like a
Okay,
good plan.
that would be great. I just, like I said, it just seems so crazy.
Yes.
I'd just like to say, we will get I had a call yesterday from President of Wisconsin County, and I will take that resolution to the steering committee, and I'm sure I can get it back to legislature. And we will get support from all the counties around. Like I said, not just one of the past legislatures, they did appropriate the money to build a facility. Came very close to taking over Baldwin before they destroyed that. But the problem is the legislature hasn't gotten the money to operate a facility. But number one, I appreciate we've got to get back to the drawing board and get a facility. If we would actually nail that down, then maybe that would put enough responsibility on the legislature to operate.
Well, thank you for bringing that up to your counties,
Yeah.
taking it forth to there as well. So, do we have any more comments on kind of that sidebar? With that, taking a look at the agenda, I believe we haven't gotten our communicable disease measles update yet.
Yep, that's how Helen is up.
Okay.
One of the requirements of public health per state statute is communicable disease investigation and control. So there are about like 100 different diseases that medical centers are required to report to public health. So we are able to monitor for outbreaks. We're able to investigate the causes and just kind of keep tabs of how healthy our community is. So last month's disease report, some of the highlights are chlamydia infections are staying strong at 4. We've been increasing in that area. We've had 2 hospital associated COVID hospitalizations, 3 Hep A cases, 6 Hep C cases, and Lyme's disease is rearing its ugly head. So we have about 8 of those already. In addition, just to like a handful of other like enteric diseases. But what I really wanted to highlight this month is measles. So just to give a little background about what measles is, and then I'll give you some information about where we currently are in Wisconsin and the United States. So measles is one of the most contagious diseases. So it's spread through coughing, sneezing, talking. It's an airborne disease. It can also be spread by like having those particles fall on a surface, touching the surface, and then touching your face, mouth, nose. The measles virus can stay up in the air and on surfaces for about 2 hours. So if we have someone who is contagious with measles, 90% of the people that are exposed to that person who are not immune will become infected. So it's a very, very scary disease. So some of the complications, some of the symptoms are, you'll see high fever, cough, runny nose, watery eyes, and then that characteristic rash. But more concerning is about 1 out of 20 people who contract measles will get pneumonia. Brain swelling is in 1 out of about 1,000, which then can lead to deafness and intellectual disabilities. Death is in 1 to 3 out of 1,000, and then also pregnancy complications is what we're concerned about. The prevention of measles, the good news is 2 doses of MMR vaccine is about 97% effective in preventing measles. 1 dose, if you only receive 1 dose, that's about 93% effective. So the recommended vaccination schedule is for children to receive their first dose at 12 to 15 months of age, and then their second dose at about 4 to 6 years, which would be coinciding with that like kindergarten start date. Important to keep in mind is that children under 11 months, individuals who are immunocompromised and pregnant people cannot receive the MMR vaccine. So we do have a lot of folks in our community who are just unable to receive this vaccine. So when we're looking at that herd immunity, we're looking at least 95% of people in our community getting vaccinated, therefore then protecting those that aren't eligible for vaccination or that can't be. So that's kind of like measles in a nutshell. And go to the next slide. These are our current or 2023 vaccination rates for school age kiddos. So age 5 to 18. So we're looking at 2 doses of measles MMR, measles, mumps, and rubella vaccine. So Polk County is at 79%. Again, we want to be thinking about 95% is that herd immunity. So I think 92% is the highest in Wisconsin right now. And then if you think about it even lower, so our, 1 to 2 year or 1 to 4 year olds are going to be even less than that. And we're only looking at 1 dose. So then if you go to the next slide and we're looking even at the US level, here's a map of how the whole US is doing. So the blue one is 95% or higher, that herd immunity level. And then red is 90% or less than 90%. So you can see our surrounding states too are lower than wanted vaccination rate. Okay. So then this information is from the CDC as of last Friday. So already in 2024, we have a total in the US of 132 cases of measles. And that's across 21 different jurisdictions, including Wisconsin. So about 2 weeks ago, we had our first measles case in an impacted Dane County and Rock County. And then you can see the stats, 53% of those folks who have measles have been hospitalized. You can see kind of the vaccination status. Most people, 81% were unvaccinated. And then it's definitely hitting our younger kiddos, so under 5. And then this is the total measles cases in 2024. Again, Wisconsin made it to the map. We had our first case. And Illinois, Chicago is having a pretty big outbreak. So as we're looking at this, we are concerned because we're getting into the summer months when people are traveling too. So if you think about someone potentially having measles, being at a, big sporting event, at a amusement park, and then 90% of the people that they would be exposed to would contract measles. So it could spread very, very, very quickly. The next slide just gives a little bit of historical data. So in 1963, the measles vaccine became licensed. So we dropped our case numbers in the United States from like 500,000 way down. And then it's been low, but now we're getting concerned again because our immunization rates are decreasing. Go to the next slide. What is our role? What does public health do? What do healthcare centers do? So public health's role is in charge of reporting and investigating. So as soon as a health center would suspect measles, test measles, they would notify us and we'd immediately begin trying to figure out where did they get it from, where have they been, what's going on. Then we would move to our isolation and quarantine guideline. We are also very focused on providing vaccinations. So for those who are uninsured or underinsured. And then we do a ton of information sharing. So we've been sending messages out to our daycares, our schools, healthcare systems, long-term care facilities, and just the general public. And then we're also coordinating between local response, state response, and then federal response too. So that's public health lane, and then healthcare systems lane is more that testing, medical treatment, treatment of symptoms, and then also providing vaccinations too. So again, what are we doing in public health? We are really trying to increase the access to routine childhood vaccinations. So we just received a grant called the Routine Immunization Community Engagement Grant. That's for 2024 and 2025. I believe there are 12 of them given out in the state, so it's very exciting that Polk received one. Our goal is to increase availability of routine childhood vaccinations in Polk, Burnett, and St. Croix Tribe. So we're going to be offering immunization clinics at schools in the fall, hopefully to coincide with Meet Your Teacher Night or Sports Physical Day, and then also one in the spring, hopefully to coordinate with kind of the Child Find kindergarten roundup kind of days also. We also hold vaccination appointments in the government center at any time. Anyone who is underinsured or uninsured could call and make an appointment, and we can provide those vaccines at no cost. And our role, again, is just to share this information, which is why I'm here today, just giving you this wonderful measles update. Any questions?
Yeah. All sorts of them. Yeah, please. Oh, okay. Thank you. So with your clinics where you provide in the schools and that, where are we addressing or are we addressing any of the vaccine resistance fallacies or, thinking that's kind of undermining people getting vaccines. Are we doing that at all?
Yes, we're sharing information. We're being respectful of people's viewpoints and how they want to proceed. So we provide information regarding immunizations to school nurses and then also their daycares too, so they can distribute to their parents. And then the goal at being at these school immunization clinics is just to be present also. So maybe a parent doesn't want to give it, they're not comfortable having their child receive a vaccine, but we're also there to answer any questions. Just be present, yeah.
Thank you.
Thank you.
When you're at the schools and doing these events, is it still for the under and you're still screening those people so only those individuals can get the vaccines? And in regards to the MMR vaccine, do you have just the straight MMR vaccine available here, or is it in combination with the varicella vaccine?
We have both.
Okay, so you just had the straight, like MMR, straight polio. Okay, because I think that's a big part of the problem.
Right.
Is a lot of the healthcare systems have the vaccinations in combination and people don't want that. And so it's difficult for me working in a healthcare facility because we have ours only combined. And I have no place to refer those people to get it that, like individually, because they have private insurance. So, I mean, is there a way to offer the MMR vaccine to people with private insurance at a community level versus?
It's a very good question. Yes, I will look into that.
Yeah, because I feel like that's been our holdup in regards to children getting immunized. Like a lot of people have private insurance, but do not want the vaccine in combination. Like they'll get the MMR by itself, they'll get the varicella by itself. You know what I mean? But they,
Let's spread out. Yep,
yeah,
exactly.
and we don't have resources or places to send these people to because most healthcare facilities have them in combination. Mainly because they want to increase their vaccination rates, but I feel like it's not necessarily working. Yeah, not doing that. Yeah.
And that's something we can keep talking with our medical centers about too, kind of getting their pulse on it too.
Yeah.
Thank you. Yes.
Yeah.
Supervisor Darby.
Thank you. So 2 questions. One was kind of taking off what both of these ladies mentioned, is that, so is there stats as far as 10 years ago, 15 years ago, what the vaccination percentage was? And as far as, what is it? Because I feel like it's gone down. That's just my knee-jerk reaction.
Yes, I don't have the numbers in front of me, but I want to say it was 90%. Like we were hitting where we needed to be.
Right,
And then
right. And that was across a lot of diseases. I mean, polio, things like that too as well.
Correct. Yeah.
So, but then to tag on, so you were talking about being at kindergarten roundup or a meet your teacher night, but then you have to screen before you're able to give a vaccination, you're screening them for financial requirements?
Yes. So public health, our funding is related only, we only have the vaccines provided to us to give to kiddos who are like on Badger care or uninsured. So that's part of our messaging to say, okay, we will be here. We can answer questions for anybody. We'll be here. We can offer on-site vaccinations for these folks. Also, here are options if you do have insurance, private insurance. These are the places you can go in their hours and trying to help kind of connect that.
Is there no option to even have any kind of, if I decided and I wanted to do it and have a flat rate fee? Could we have a discount? I mean, I know there's a ton of rules around this stuff. I know that, but I mean, it's like, here, either you qualify or here's $20 and, I mean, I'm like, wow, I feel like that's such a great opportunity to have it add these 2 things, but we're missing such a huge opportunity, a window of people there. And then like, oh, well, it's those people that can get their kids vaccinated. Right. There's stigma with that. There absolutely is. And I'm not saying it's your fault. I'm like, is there a way to, or options to get through that?
We can look into it. It's the kind of the budget piece too, because then we would be responsible for purchasing the vaccine at cost and then administrating it, but we can look.
I know, I think some counties bill insurance for
Yes.
vaccination for private.
And we can. I think the issue is
Yeah.
the vaccine we get is we aren't paying for, so we
Yeah.
can't. So
You get private
we
stock.
could, but then there's how long, sometimes once you open a vial, it's only good for so long. So I think it's that budget impact and what would that look like? So, you go, you give a vaccine of, I'm just making numbers up, Helen. So sorry for anyone who's a nurse and there's 20 doses in there, you give 1, then, and we can bill insurance because we do have that set up and we have started doing that through our EHR that we just got this last year. So we can, it's just that budget piece and what does that look like? Or maybe we would have to have people sign up so we knew, hey, we have 20 doses, that type of thing. Kind of what we did with COVID back when we had that.
And as far as like the venue for kindergarten roundup or meet your teacher night, I would want to do some careful thought on what that would look like, having a vaccine clinic at one of those rather than just doing the education and getting the permission or the go ahead for when we do come in and have an established clinic, because that could be also very stigmatizing and separating of people, because vaccines are very political right now. So I'd want to be careful about that too, to make sure that we were not harming any kids or parents and whatever their beliefs might be, but just having those educational sessions and getting the go ahead to be able to do the vaccine. So we will definitely put some thought into what that would look like. Also need schools to be on board with us coming in and giving vaccine. We learned that really quickly during COVID, that some do, some don't. And it actually affected our flu clinics with children because they were afraid that we were going to be giving COVID vaccine at the same time. So we just gotta be a little bit careful about that too.
So you did flu vaccines in the schools, right? Like during,
Yes.
and was that for all, or were you screening then? Cause I feel like when that came home, there wasn't like a screening on there. Were you screening? Like insurance
It
staff?
was for all. We were able to send folks down either road. So yes, we can look at it.
So we have VFC and then we purchased flu vaccine
Oh,
too.
good private.
So we screened it. We knew, so the nurses knew which lot they had to use because we did that pre-checking our own.
But you
So
didn't bill those people with insurance?
Yes, we did.
Oh, you did?
And billed their insurance because you had to put your insurance information on there.
And if they were under or uninsured, it was a vaccine for children program that we used to
Right.
give them those vaccines for free.
Same when we do the flu clinics for adults, same thing. We have 2 pots.
Do you have a way to screen, like if someone had private insurance but told you, nope, I don't have insurance? You just go by what they say, what they tell you?
That's a state requirement,
Yeah.
where we
But-
don't have to ask for proof of show me.
Yeah.
So if they didn't
Just
put
the
they had
word.
health partners and they just put that they were
The
that,
word.
we would give them the,
So it's just by that you go by their word.
correct.
Yeah. Unknown caller.
For the vaccine piece of it anyways, because we have the VFC.
Bill?
Pam, just go back to the comment that you made. I can tell you, going farther back than 10 or 15 years, the 8 school districts in the county, way back when Gretchen Sampson was here, when we had our principals and district administrator meetings at CISA, she always provided health information. I can tell you that the 8 school districts in the county ran between 85 and 95% vaccinated kids. State statute provided that a child coming in to register for kindergarten would not be allowed in school for 10 days, provided they had to show proof of vaccination. Well, unless a parent signed a waiver that the state provided, they could sign off and say, we're not going to get our kids in. We don't want our kids vaccinated. Then we would allow them into school without any problem. And, now I know that those numbers are going down. And I know that I give Tanya a pain every fall because I always ask her for those statistics for the 8 schools in the county. I want to know that. I want to know where their vaccination rates are that come through public health. Because it's fascinating, because I had parents that used to come in and say, I'm not going to go to so-and-so school district because a lot of their kids aren't vaccinated. I'll
Right.
come here.
Right.
Now, that sounds strange, but we had parents that did that. And they felt more protected because of that MMR vaccine when they came in. So just to follow up
Thank you.
with that.
Supervisor Olson?
So why is Chicago the hotbed in theory?
I think they had, from my understanding, they had one case in a very, very highly populated area. A lot of people together, a lot of unvaccinated people together, and it just keeps.
Dr. Elias?
Several years ago, there was a person that went from United States to overseas and contracted measles, came back to her community where they were not vaccinated, and there was about 50 cases of measles that was. So if you have any friends, relatives who are going overseas, they're not measles vaccinated, they're at risk.
I think if we can break the barrier between, like I get your VFC, so I'll get more private stock. So when you go to these schools, you can offer it to all versus just certain people. I think that would be huge for the community. I think that is a huge barrier.
Get back.
Can I ask a quick question? Is there a reason why like the clinics are only getting the one that's mixed versus getting them separate? Because it sounds like they're available.
Because they want to, their thought was that they would increase vaccination rates. And then, of course, when your vaccination rates are high, it's easier. But I mean, they'll say, you know, some parents at one point were like, oh, it's just one poke, it's just one poke, but you can get all these shots. But now, ever since COVID and the COVID vaccine, people don't want 3 vaccines in one. And then you don't know what that child is reacting to when they do have a reaction. And then they don't want any vaccine after that at all. But it's been difficult. I mean, we're trying as providers to get vaccines individually, but it's expensive, you know, and waste, like you said, is an issue. But it's not helping our vaccination rates, I don't feel like locally, so.
Okay, do we have anything else? No? Okay, then, thank you.
Can I?
Oh, yes.
I'm the physician representative on the committee. I worked in St. Croix Falls, Frederick, and the hospital in St. Croix Falls for almost 56 years. Now I'm retired for 2 years, and I'm still happy to be on the Polk County Health Committee. And I'm just going to make a couple comments about what's going on. There's still COVID. I just listened to Mike Osterholm's SIDRAP report last night from May 1st, and he's the director of infectious disease at the University of Minnesota, was an advisor to the president. And so his comment was that currently the death rate from COVID was 648 people a week. And 11 weeks ago, it was 2,500 people a week versus 26,000 January of 2021 per week. So we've come a long way, but COVID is not over. And so if you're over 65 or 60 and you are immunocompromised, you should get another booster. They think that there will be another new booster against the N1 variant this fall. And when that will come, I do not know. But the current real worry is H5N1, which is they're calling the bird flu. And his comment was that this has been around since 2009, and at that time there were periodic outbreaks in China. 100 people would die, and then it kind of would disappear. And so now it's been mainly in the hens, chickens, wild birds, and then now it unfortunately has spread to mammals, about 200 different kind of mammals, and our dairy cows, and so some of these have been in Texas, and the issue there is that now they can find remnants of this virus in our pasteurized milk, and so it's still safe. So I say the government says, and he says, and I'm repeating what he said, that drinking milk that's pasteurized is still safe. It is not safe to drink raw milk. And as an example, in dairy herds where people have cats running around and they're drinking raw milk, about 50% of those cats have died. And so it's really not safe to drink raw milk. In addition to possibility of getting H5N1, you can also get E. coli O157. Campylobacter is a bacteria that I actually treated in the hospital. Somebody who had drank raw milk in Polk County when I was a physician and active care. So And his other concern is that if this becomes a pandemic, no tests have been developed to how you can find out if you have H1N1. Second thing is there's no vaccine development currently for this particular virus. So far, what I read is that cottage cheese or yogurt it has not been involved with H5N1 as the milk has. So it's I think we all need to just keep our ears open and see what happens. So far, the government is not testing sick cows other than the only cows that the government is testing for this virus is if you're gonna sell a cow and move it out of the county or to somewhere else in the state or in another state. But I would, my personal thinking is that you should test all cows and get the sick ones out of the food source.
That's very good information. Just a quick question I have, and I'm sure that we have somebody here who can answer it is, I see sometimes where like on Facebook groups and things where people are looking where they want to buy raw milk.
Yeah.
That's not legal, is it? To sell raw milk for human consumption?
It is.
It is. Oh, okay. I'm mistaken then.
You can't sell it at the store.
You can't sell it at the store, but you can privately sell raw milk for
Come buy your eggs
consumption.
and your milk and whatever else they want.
Okay. I mean, I drank it growing up but I understand the dangers associated with it as well. So, yeah.
I think that people who lived on farms and they drank raw milk, I think they got used to it. The issue was my patient who got Campylobacter was a visitor to the farm. And maybe the first time they drank raw milk and they got sick.
Sure.
You know, because their immune system wasn't used to the bacteria in that particular product. And so they had no antibodies or resistance to that bacteria. So I think we need to advise our friends, that it's a risky proposition too.
Yes, definitely.
And that they're taking a risk of becoming ill.
Well, thank you.
Thank you.
Yeah, thank you for giving us that information. Do we have any other comments pertaining to that? We don't. Next, we have our legislative event report.
We got a call from the legislature yesterday and they're forming all the new committees and I'm the representative for 5 steering committees. And they'll all be starting in July. So I'll be attending all the committees in July. It sounds like I'm sure that they're all gonna be in person rather than on Zoom. And the president told me, he said that I sure want to favor the in-person meetings rather than Zoom. He frowned on that.
Yeah.
I'll be bringing you up to date on everything.
Well, good. Thanks for doing that, John.
I've got one local legislative update, and this is mostly for the citizen members of this board. The last board recommended and this county board adopted the new rules of order. And so anyone who appears virtually at any of these meetings, you'll still be able to participate and vote, but you will no longer receive per diem unless you're here in person. So that's just to be transparent, so you're aware of that in the future. Again, you can participate if you appear by Teams or Zoom, whatever we're using these days, and but you won't get the per diem unless you come here in person.
Is that for all of the committee members or just the citizen members?
Everyone.
For everyone?
Yep, for all the committees in the county board.
Okay, that's good to know. Okay, do we have any other updates? No? Okay, then, moving on to identify subject matter for our next meeting. So we've already identified the resolution and discussion and those 2 items to bring forth. And looking at our work plan, It looks like traditionally there is also some discussion on budget priorities. Also excuse me, I was looking at May. Let's look at June here. We have our committee orientation, departmental annual reports, a medical examiner update, and then some preliminary end of year financial report. That's something maybe that will go in July, post audit, or kind of want to hold off till we have the audit numbers, or what does everybody think about that?
I think the preliminary is referring to what you just did, is it not?
Yeah, so that may have been bumped and copied
Okay.
over by the clerk from a previous year because we
Okay,
did a little ahead of this year than some past years.
that had occurred to
Just
me,
did
but,
hear from the auditor. They are
okay.
reasonably confident.
Do any of our other members here, Supervisor Olson?
Could we get a list of everything HHS does that's either mandated or unmandated? I mean, and maybe everything it does is mandated. I don't know.
You mean programs that this board oversees?
Yes.
Not just what's in community services division?
Right. Everything this board oversees that's either mandated or just something that we do, I'll say,
The service.
state or federally mandated, or, if the county says, hey, this is what we're gonna do.
Sure,
I
sounds
believe
good.
some of that will be covered in the orientation.
Yeah.
Would that, can we try that first and see if there's still questions? Bring back another. I mean, we can talk all day long on it. So I just want to see if that would,
I'm just looking for a list on a piece of paper, if that's possible. Maybe it's not. I want to make it as simple as it can be. I'm not looking for anything complicated.
okay. Yeah, well, I guess to say this committee is not complicated would be an understatement. So I just want to make sure that we have what you're asking for in the most understandable way for mandated versus non-mandated. I think we put together a document, is it last year? On the county mandated versus non. Vince had us do
I
that
vaguely remember that.
on all county services.
Yeah.
Operating a nursing home,
Did you guys
Yeah.
ever receive that document?
I
Maybe
don't-
we could get
I
that
don't
out to
remember-
you.
It's from
I don't
last
remember
year.
seeing
I
it.
would, Supervisor Olson, I would say that each time the division or department chairs give their reports, they always talk about mandated and non-mandated services.
Okay.
So I think that, and I'm just looking at Diana here, because I know she always does that, for things that are required by the state compared to what is not required as far as monetary things go.
Well, and there's add-ons that we do that are not necessarily mandated. However, they prevent that strain on our mandated services. So I think I'll dig up that document that we had put together. And then we'll customize something for this committee to try to get that list.
Okay.
Sound okay?
Knowing that there's gonna be caveats on every one of the
Yeah.
plans probably, so.
Okay, do we have any other thoughts for our next meeting?
So we do, the committee orientation typically starts earlier, and back when we started at 10 a.m., we would start the orientation at 8:30 and go 8:30 to 10, and we talk really fast during that orientation. We're trying to simplify it even more so that we can be more succinct in what we're giving you. So what time would you like that to start, and do we need to delay the start of our normal meeting since our start time is now 9 o'clock? So we lost an hour on that.
What's the time that would work for everybody? Want to start?
5:30 in the morning works for me.
Absolutely. I don't know, before 8? Are people okay with starting before 8?
You will not have certain people here if you do that.
Okay, so is this something that traditionally has broken into 2 pieces, orientation one day and the meeting the other, on a different
It'll
day?
just be a longer meeting.
It's just a longer meeting?
Yeah, we just start at 9 and then
Start at 8:30 or 9. It's
Yeah.
just a
So we've
longer
done.
meeting.
Sabrina is suggesting maybe we do orientation after.
Yeah.
Okay.
So we can have our normal, it's more of a challenge to change the meeting time, I think, the official meeting time.
Right.
So if we show up at, go 9 to 11 and then 11 to 1 or 11 to 12:30 for the orientation. Do a quick
Light
break in
lunch or
between or something like that and provide a light lunch. That works for people.
Sounds good to me.
Okay.
Sound good to everybody else? Okay.
We'll bring Andy his presentation back for the June meeting.
That's listed on July.
For what?
ESO is listed on July.
He had a special presentation and I think the county administrator asked him
Okay, no, I just,
for committee assignments. I think that was the purpose of him coming today because everybody has non-standing committee assignments that need to be made or confirmed at county board meeting next week. So he just wanted people to have information on what those other departments were doing, just to have a little bit of awareness of what you could be stepping into for those committees.
So Dr. Lagus and myself attended the opioid summit last week. I don't know if that's traditionally something we would give a report on at a subsequent meeting or what you've done with that in the past.
We can do that.
Doesn't have to be long, just kind of hit the highlights. of
Yeah,
that.
I actually tried to go to that meeting and they required a invite code. Which I couldn't find.
I had trouble with that as well, getting going with that, and they had that special app. And Shabana was very helpful, and she was able to, we had to kind of coordinate our schedules and get on the phone together because we're registered with the county clerk's email address. The code or what we needed would go to her, and then she was able to get me in for it. So
Yeah.
in any event, I can give a quick.
So the Tuesday of he was available, he was
Oh.
working, and so,
Yeah.
so after a while, I just said, oh, okay.
Yeah, it was a frustrating, way to get in there and do that. I share your frustration with that. But in any event, well,
Looking forward to your presentation.
okay, well, okay, I'll see what I can get together here. We have anything else for our next meeting?
Just the medical examiner update. So I think Jamie should be fully staffed and ready to give us her first medical examiner.
Okay, very good. If there's nothing else, then I'll.
I move to adjourn.
Okay,
second.
okay, very good. Folks.
Yes.
Yeah, he's home for the summer. That's so nice.